Welcome to the first episode of Bob's Health Talk. Information shared here is not meant to diagnose or to replace your doctor's advice. So today we're going to talk about hypertension or high blood pressure. Normal high blood pressure is top reading number less than 120 and bottom reading number less than 80. Abnormal blood pressure or numbers that are concerning for hypertension are numbers above 130, that's the top number, and lower number above 90. There are also people that are allowed to go up to 140 and before they're considered to be having abnormal blood pressure. I'll leave that to be you know done on an individual basis based on your doctor or based on your conditions. What causes hypertension? One of them is lifestyle, and in lifestyle, these are things that are modifiable, and they're things like weight, what you eat, whether you exercise or you don't. Then the other thing that causes high blood pressure could be just family tree gene. So if you have a gene for hypertension or the genetics for hypertension, then that can cause you to have high blood pressure from grandma, grandpa, or mother, father, or stuff like that. The other thing that might cause high blood pressure is the organs. So especially the kidney or the thyroid. The thyroid controls the body metabolism. So if it's not functioning well and it's overfiring, it might cause you to have high blood pressure. Are there signs and symptoms of high blood pressure? Hell no. We do not have obvious signs and symptoms of high blood pressure. However, there are some signs that if you have, you might be concerned for having high blood pressure, and they include things like headaches, blurry vision, chest pain could be one of them, or just lightheadedness. Most of the time, this disease is known as a silent killer for the simple fact that there are no obvious signs and symptoms. So, what are the consequences of hypertension or uncontrolled blood pressure? One of them is a stroke, just like I said, a CVA. The other one is heart attack. You can get a heart attack from high blood pressure. Also, if you know the high blood pressure is left to just roam around without being controlled, then you might end up with thing organ failure. Kidney failure is one of them. Then how do we prevent you know high blood pressure? One is just basically changing your lifestyle. So if lifestyle is contributing to the elevated blood pressure or the high blood pressure, then changing things around might help. So if you're overweight, then try to lose weight. If you're not exercising and having a sedentary life where you're just sitting around and try to get moving and exercise, then also the other thing that can help here is just changing the types of foods that you eat, especially sodium, salt. So salt does contribute to high blood pressure. So decreasing the salt intake can help. Just trying to move from salt to just routine seasoning, just using Roico, stuff like that, might help you prevent high blood pressure. Also, eating foods that are high in fiber, that can help. And the other thing is also screening, just going for annual screenings, especially if you're age 18 and over. So from age 18, you can go for blood pressure checks. So check your blood pressure every year and they see where they are. So if there's a trend where you're trending upwards, then you can start making those lifestyle changes before it catches with you. Um, the other thing that you can also do that can help with screening for high blood pressure is basically blood work. You will get the labs done, and if there's something wrong with your kidneys or there's something wrong with the thyroid, that could be picked up and could help prevent the high blood pressure. Um, and so, what are the treatments? So, if you have high blood pressure, how do you get treated? So, there are a lot of medications out there that can help with treating blood pressure. So, you first try all these lifestyle changes of waiting, losing weight, exercising, eating right. And if that still doesn't help bring your blood pressure down, then probably it's time to get you into medication. When to start medication will also be something that you have to discuss with a provider or your GP. I'm more than ready to talk to people on a one-on-one on the side if you have issues with blood pressure, and I can I'd give you advice and share it with your doctor and see if it's helpful. So like I said, there are a lot of medications, and you could be in one you on one medication, probably starting a low dose, then they increase it, and then they maximize that dose, and if you're still not controlled on a higher dose, then they can add another agent, another medication that can help bring your pressures down in a different way. So it's okay to be on more than one blood pressure medication, in as long as it brings your blood pressure down. There are people that are on more than one or two or three blood pressure medication. I do say that it's okay to take those medications if it's helping the blood pressure, as opposed to getting a stroke because your blood pressure wasn't controlled. If you have any questions, any concerns, please reach out to me. I'll be available to help you out where I can. Next episode 2, we'll talk about arthritis. This is geared towards our elderly that are complaining of joint pains or just general aches. Feedbacks are more than welcome. Bye. See you next time.